So welcome back guys. Here in this session we will be talking about the preventive obstetrics basically, right? We're talking about the main important components regarding the preventive obstetrics. So guys, very first topic which I will be discussing over here is that what is antenatal care visit, right? Antenatal care means we shall understand is here the antenatal care means I am talking about the ANC visits. ANC I mean antenatal care. Antenatal care. It is not anti, it is not ANTI, right? Anti means against, but here this ANTENT means before. So anti, before, natal means birth, before birth, okay, visits. So antenatal care visits we are going to talk about over here, right? So basically, ideally if I am saying that, before planning the pregnancy also, the couple should be actually, the family should be actually, consulting with the doctor about the, about the pregnancy and about having their future baby, right? About the plans of their future baby, they should be consulting with the doctor and, they will be going for some important test, for example, the screening test for different kind of diseases. And then they will be, telling them that you shall be planning for the baby or you shall wait for some time and then plan for the baby and all these kind of things. I know in India it is very, very rare. It's not happening very commonly. But in foreign countries, yes, it is happening in some countries. That is the ideal situation. Now coming to the next situation, right? After that, if one couple had the intercourse, right? And they were planning for the pregnancy, they had the intercourse and now the female is having pregnancy as well. So if they are having pregnancy, right, one thing is the female and the couple and the family don't know about the pregnancy. That could be the thing during the first month probably, and then when the second month the periods has been missing, they will be coming to know about that. They will be doing several kind of tests, pregnancy kits are available these days, right? So they will be doing that and they will be coming to know about the pregnancy, right? So ideally they should be going to the doctor about the pregnancy once they are coming to know that they are pregnant, right? So that is the antenatal care visit, right? The first time when they are getting pregnancy, right, they should be reporting to some obs-gynae doctor, isn't it? So everybody agrees with that. But now the situation over here is, in many cases we are seeing that the females are coming, the family is coming, the females are coming to the hospital when they are in labor, right? Forget about the pregnancy. When they are in labor, right, about to deliver, when they are in the labor pain. Many of the cases we are seeing that when they are in the labor pain, then they are coming to the hospital, right? And before that, they never came to the hospital, they never visit to the hospital, right? They are not having any kind of test in hand, they haven't did any kind of test before the pregnancy and all, during the pregnancy and all, right? And now directly when they are in labor, they are coming to the hospital, right? So in those conditions, these are the different situations. So that should not happen. So ideally, we should be having the antenatal care, proper antenatal care visits, so that we shall rule out different kinds of diseases at the first place, and if there is some kind of disease, then we shall be treating it at the earliest possibility, because if there is some kind of disease, if we will be treating that disease, so we shall be preventing so many of complications regarding the mother as well and regarding the baby as well, right? So it's good for the both, win-win situation for both. So that's why antenatal care visits are having very important vital role, right? So WHO says that, there should be 8 visits before the birth of the baby, right? So like from the pregnancy till the birth of the baby. Antenatal visit, they are saying ideally, there should be 8 visits according to WHO. But forget about the 8 visits. Government of India says that if any kind of female is getting even 4 visits, that is also enough, right? Especially in the rural areas where the females are not be able to approaching the doctors, obs-gynae specialist doctors and all. So if the 4 visits are also there, then that is also fine, right? But if some couple is capable of that, right, in the urban areas especially, right, they should be actually visiting, they should be having 8 visits, right? So if in case the MCQs are coming regarding that, then you will be marking that 4 antenatal care visits we are talking about before the birth of the baby, right? So now coming to the topic, guys, ANC visit, right? ANC visit, we are having 2 things, that WHO is saying something and then Government of India is saying something. GOI is the Government of India. WHO is saying that go for the 8 visits, right? The one couple, the one female should be having 8 visits before the birth of the baby, right, during the whole pregnancy. And if you talk about Government of India, if you talk about the India, they are saying at least there should be 4 visits. At least there should be 4 visits. Now, look over here, guys. If you talk about the ANC visits over here, we are seeing that ideally, guys, I am talking about ideally. One situation is ideal situation, right? Now, everything is not ideal. Other situation is minimum. So, if you talk about the ideal situation, there could be 13 ANC visits, right? There could be 13 ANC visits, antenatal care visits. Now, in the first 7 months, once a month, there could be the first month, 1 visit, second month, second visit, third month, third visit, right? So, like that, they shall be going to the doctor for the visits, right? Then, in the last month, once a week, because that is very close period to the birth of the baby. So, that's why every week, in the last month, in the 9th month probably, every week they should be visiting the gynecologist or obstetrician, right? Okay, but that is the ideal situation. Now, what is the minimum case in India I am talking about? This is the India. This is for India. In India, if they are asking you, they are talking about 4 ANC visits, 4 antenatal care visits. They are saying that first visit would be there, then within the 12 weeks. Within the first 12 weeks, within the first 4 months, right, or within the first 3 months, I would say, right, in the first 3 months, 1 visit should be there, right, as soon as pregnancy is confirmed. Now, as the couple is getting to know about the pregnancy, they should be visiting the doctor. Second visit will be there between the 13 and the 26 weeks, that is probably in between the second trimester. Then third visit between 27 and 34 weeks, third trimester, and fourth visit between 36 weeks and the term, right, between 36 weeks and the birth, right? Obviously that will be the 4 visits. So at least, this is about at least, right, minimum visits we are talking about. Ideally, there could be the 13 visits. And WHO says minimum 8 visits, right? If I was saying WHO, you know, these visits I was talking about that minimum, at least these visits should be there, right? But usually, I told you what is the situation, right? Usually, the females are coming when they are directly in the labor pain, right? That is the thing. There could be many circumstances, right? It's not always the female will. It's about the family and all other things. It depends on the husband of the wife also, husband of that female also, all many other factors could be there. Now, this is about the India, guys. I told you about the India. What is the situation? How about WHO? I told you about WHO, right? About 8 visits I told you. According to WHO antenatal care model, they are saying that in the first trimester, right? In the first trimester, that is the contact one, right? Up to 12 weeks, as in India also, as soon as they are coming to know about the pregnancy, they should be visiting the doctor. That is up to 12 weeks. First visit should be there. After that, in the second trimester, look over here. After that, in the second trimester, they are saying there is a contact too with the doctor, right? At 20 weeks and then 26 weeks. At 20 weeks, second visit. At 26 weeks, there would be the third visit. Then come to the third trimester. In the third trimester, they are saying at 30 weeks, the fourth visit, 34 weeks, fifth visit, 36 weeks, sixth visit, 38 weeks, seventh visit. And in case if the baby doesn't deliver yet, then at 40 weeks, there would be the eighth visit, right? And in case the delivery didn't happen till 40 weeks and extend up to the 41 weeks, then obviously they should be coming again for the checkup, right? If not given birth, return for the delivery, right? Now, usually at 40, most of the females are delivering, but at last 41, right? At 41, we will be initiating the labor. If naturally the labor didn't happen, gynecologist will be an obstetrician. They will be actually, we are starting the labor, right? Labor process, because we don't want to delay the birth of the baby unnecessarily, right? That is the thing. And we know that 37 to 42 weeks is the normal term baby. After 42 weeks, we are telling that this is the post-term baby, right? We'll talk about that as well. Okay, guys. So that is about the WHO model. So I compared the ANC visits as far as India is concerned and as far as WHO is concerned, right? Once you are clear with it, so once again, guys, Government of India, minimum visits 4 visits. According to WHO, minimum visits 8 visits, right? So please do remember that. Now, once we have talked about that, we know that in the pregnancy, right, normal changes in the pregnancy, you will be studying that in the obs gynae classes very well. But here I'm just talking about what is the recommended weight gain during pregnancy. Obviously in the pregnancy, there are 2 life, right? One is mother and one is the baby. So for that, the nutrition and all of these things has to be taken care of accordingly. So obviously there would be the weight gain during the pregnancy, right? But there is some criteria, isn't it? According to the BMI, we are saying that they have actually defined that this should be the range for this particular BMI as far as females are concerned, right? This should be the weight gain. So for an example, here we are seeing that, for the underweight females who's having the BMI less than 18.5, they are saying who is having the pregnancy with one baby, they are having the range of the weight gain that is in between 12 to 18 kg. And if they are having twins baby, then it is between 22 to 28 kg, right? But overall, you should be remembering this range. You should be remembering this range, right? If they're healthy weight, right? Most probably the question will be coming for the healthy weight. In the healthy weight, you are seeing that pregnancy with one baby, they are saying 11 to 16 kg is the weight range over here, which can be the weight gain, right? 18.5 to 24.9, that will be the BMI over here. That is the BMI over here. 16 to 24 kg for the twins. Then overweight, 25 to 29.9, that will be the BMI over there. 6 to 11 kg is the permissible weight gain range for the one baby, and 14 to 22 kg for the two babies. As far as obese are concerned, 30 or higher, who is having the BMI of 30 or higher, 4 to 9 kg is the permissible limit for the weight gain for having the one pregnancy, one baby, and 11 to 19 kg is the permissible limit for the weight gain range if they are having the twins baby, right? Now, one thing I would like to mention over here is that, when we are talking about the weight gain, right? Please remember that average weight gain during the pregnancy, right? If we are talking about, that is around 9 to 11 kg, I told you, that is around, right? That is around, here they are saying that 11 to 16 kg, right? So probably that is the weight gain which we are expecting in the pregnancy, right? Obviously it depends on BMI, it depends on other nutrition factors also, right? That is also the thing, but here they are just giving the overall idea. If you talk about the increase in weight of the mother or weight of the female, right? It should not be more than, right? It should not be more than 2 kgs per month, guys, right? Especially after the second trimester, right? So how can you remember that? Second trimester, by the 2 you can remember that after second trimester, more than 2 kg more than 2 kg per month body weight is not allowed actually. That will be considering under the overweight category over there. So increase in weight of the female should not be more than 2 kg per month after the second trimester. That is the thing which you need to remember if you talk about the recommended weight gain during the pregnancy, right? So overall around 10 kg, right? Around 10 to 11 kg we are talking about, 11 to 15 kg, that is the pregnancy weight with one baby, right? Okay. Now guys, if the female is coming to us, the pregnant female is coming to us, right, for the antenatal care visit, we should be doing some screening test, right? So when you will be doing your obs-gynae posting or when you will be doing your internship in the obs-gynae department, right, what was the task of us, right, as a during the internship time, what was the task? The female will be coming to us and we need to take the sample, right? And we need to take the sample for various kind of tests, right? So we will be doing the screening test for this particular female. Why we are doing the screening test? So that we are confirming that other kind of diseases we are ruling out at this stage only. For example, the mother might be having the hypertension, the mother might be having the diabetes, or mother might be having some other kind of diseases. So we will be taking the proper history first of all. We'll take the proper history from the mother, right? And then we'll be going for the screening test. So first of all, when the mother is approaching to the doctor, right, and you're a doctor over there in the obs-gynae department, let's say, obviously they will be going to the obs-gynae department, and accordingly you will be referring this female to the other doctors. For example, if she is having the issue with the diabetes or if she is having the issue with the hypertension, you will be referring this female to the physician, right, for the diabetes or for the hypertension purpose, and you will be writing that I am referring to the physician for this particular purpose, right? Then if there is some other kind of problem, if there is some cardiac issue, you will be referring to this female to the cardiologist, and if there is some other kind of, so accordingly we will be referring this female. So first of all, our job is to take the proper history of the female, because at that point of time only, by taking the good history from the female, by taking the good history from the mother, we shall rule out many of the diseases, right? So that is the thing. So first of all, when the female is approaching to the doctor during the ANC visit, right, we should be taking the proper history. So proper history taking should be there. Once we are taking the history of the patient, right, after that we shall be coming to the screening test. We shall be coming for the screening test. Some of the screening tests I am mentioning over here itself, right. For an example, screening for, we shall do the screening for anemia, we shall do the screening for several infections. So I'm just mentioning about them. For example, we shall be doing the screening for anemia, right? Screening for anemia. We know that what is the permissible range for the hemoglobin. If I'm talking about, obviously you will be seeing the hemoglobin for the anemia purpose. So if I'm talking about obviously we are talking about pregnancy, less than 11 gram per deciliter. Okay, so that is a range. If it is hemoglobin is less than 11, then we know that this is the anemia, right? So accordingly, it depends on the grade of the anemia, that what kind of grade is it, mild, moderate or severe anemia. And if it is severe anemia, right, we need to arrange the blood as well, right? So hemoglobin, if it is less than 11 gram per deciliter, I'm talking about the pregnancy. I'm talking about the pregnancy, right? In the normal female, it is 12. In the male, we are taking it as 13, right, gram per deciliter. So that is for that one. Then we shall be doing the screening for several kind of infections, right? Screening for several kind of infections or parasitic infections or all of these things, we will be running the test over there, right? If there could be two scenarios. You might be working at the PSC or CSC level, you might be working at the CSC level, or you might be working in the corporate hospital, in the urban areas, or in some tertiary care hospital, right? So if I'm talking about at the CHC level, or you are talking about the rural area, right? So one condition could be rural area, one condition could be urban area. So for the, let's talk about the rural area. In the cases of rural areas, right, we are generally doing the urine test, right? We will be asking for the urine sample, right? And we might be doing the malaria test during the by using the rapid diagnostic kit, right? We'll be using the rapid diagnostic kit. But let's say if you are working in the urban areas, then we will be running several other tests as well. For example, yes, we will be looking for the urine test, right? We'll be looking for the urine test. Why we are looking for the urine test? Maybe urine routine test. Maybe we shall be checking for some of the sugar in the protein, or some of the sugar in the urine, proteins in the urine, right? There could be proteinuria or some other type, pus cells and RBCs and WBCs, and all of these things we will be checking for the urine routine microscopy we are doing. So that thing over here, right? So urine RM or urine routine microscopy we shall be running over there. Along with that, you might be doing the malaria test also during the rapid diagnostic kit, right? Malaria test you shall be doing. Other than that, you shall be going for the infection. I'm talking about the infection over here. We are having the triple infections screening kit, right? There we shall be screening for the syphilis, we shall be screening for the hepatitis test and the HIV over there, right? So we shall be going for the triple screening test, right, or triple infection screening. Here we are actually talking about which things over here. We shall be talking about the syphilis, that is the VDRL test we are running for that, or we shall be checking for the hepatitis and the HIV, right? Mainly the hepatitis B we want to confirm over here. Okay, then we shall be talking about the very important, that is the gestational diabetes mellitus. GDM is gestational diabetes mellitus. Okay, so now let's talk about the gestational diabetes mellitus. That is important for us to know about that. So even if you have talked about that in the obs-gynae as well. So GDM, if we talk about, guys, right, let's talk about the gestational diabetes mellitus. Let's talk about the gestational diabetes mellitus, that is the GDM. Right, now gestational diabetes mellitus, basically we are checking the oral glucose tolerance test over here, right? Actually what happens is, within 12 weeks, within a period of 12 weeks, when the female is coming to us first time, as soon as she is getting to know about the pregnancy, she will be coming to the doctor, obviously. And if you are a doctor, then you will be checking for these tests, right? Malaria test and urine screening, urine routine test, urine RM test, right? Then the triple infectious screening test, and all of these you will be running for the gestational diabetes mellitus, right? You want to know that what is the sugar status over here, right? So what you will be checking for, first of all, she should be having the fasting for around 8 to 10 hours, right, before this test, We are talking about the OGTT, that is the oral glucose tolerance test. Yes, you might have heard about this in the obs-gynae and the medicine as well, right? Several places you must have heard about that. Oral glucose tolerance test. Oral glucose means you will be giving glucose orally, right? You are not injecting, you are giving the glucose orally, right? So you will be mixing the sugar into the water, and you will be asking the person to drinking, asking the female to drinking basically. So within 12 weeks, right, if the female is coming to us at the very first time, we will be checking for this particular gestational diabetes mellitus. We'll be running our screening test, right? So we will be doing which test over here? That is the oral glucose tolerance test, that is the OGTT. What is this OGTT, oral glucose tolerance test? How we are doing the OGTT test? Look over here, oral glucose tolerance test. You know, we will be actually giving the 75 ml of glucose drink to the person, right? But here, please remember, the person should not vomit, the female should not vomit. If she will be vomiting, then we need to repeat this test next day, right? So please remember that this test will be considering successful when she is not vomiting after drinking this particular solution, right? So 75 ml glucose, right, will be asking the person to drink it, and then we will be waiting for about 2 hours. After that, what will happen? Obviously, you ask the person to drink the glucose, right? Obviously, the sugar level will be increasing. Now you will be taking the blood sample from this person, right? You will be taking the blood sample from this female. Obviously, you are checking for the GDM screen, gestational diabetes mellitus, right? So now what you shall be finding over here, you know, let's say there is a pregnant woman in the community and she is coming to you less than 12 weeks, right? So, you know, take a testing of GDM at the first antenatal, that is the first antenatal visit. Remember, according to WHO also and according to Government of India also, the first antenatal visit will be there when the female will be coming to know about the pregnancy, right? That is less than 12 weeks. She will be coming, so you will be you'll be giving the 75 gram of oral glucose, and you'll be taking the blood sample after 2 hours, right? You'll be waiting for 2 hours and you will be taking the blood sample from this female after 2 hours. That is called as the OGTT test only. That is the OGTT test only, oral glucose tolerance test. So now what will happen? There could be two conditions. One condition is either the test could be positive, either the test could be negative. In what case it could be negative? If the 2 are postprandial sugar or postprandial glucose, if it is less than 140, then we will consider that it is negative. If it is more than 140, then we will consider that as positive, right? If it is positive, then you need to manage it. If it is positive, then you need to manage it according to the diabetes guidelines, right? We will talk about that. If it is negative, then you need to wait and repeat this test at 24 to 28 weeks of pregnancy, right? Now you will send this patient home. Now 24 to 28 weeks when this patient will be coming for the antenatal care visits, now again you will be going for the OGTT test. Now this time, if it is positive, then again you need to manage the patient. But if it is more than 140 milligram per deciliter, if the blood glucose is coming 140 milligram per deciliter. But if it is negative, guys, then obviously what will we do? You will be ruling out the GDM in this case, right? Now in this case, you will be ruling out the gestational diabetes mellitus. Now this patient is not, you will be considering that this patient is not having the diabetes now, right? What I said, first time when the patient comes to you for the first antenatal visit, that is less than 12 weeks, you will be running other kind of screening test. Along with that, there is one test among them that is for the gestational diabetes mellitus, right? We are calling that a screening test. What we are doing, right? We are asking the person, first of all, before this test, they should be having the fasting for around 8 to 10 hours. Then we will be asking this female to drink 75 grams of glucose. We will be drinking, we will be actually mixing it in water, and they will be drinking it slowly, right? By sip by sip. We will be waiting for 2 hours, right? Remember, the patient should not vomit, right? If she will be vomiting, then we need to repeat the test next day, obviously, not at that point of time. So if the person is fine, right, then after the 2 hours, we will be taking the blood sample of the female. In the blood sample, we will be checking for the blood glucose levels, right? If it is less than 40, it is negative, right? More than 140, then yes, this person is diabetic, female is diabetic, and we will be considering this female as diabetic, and we need to treat this patient according to the guidelines, according to the GDM management guidelines, gestational diabetes mellitus management guidelines. On the next hand, we are having, the test might be negative. Now we will call this female when she will be coming for the upcoming antenatal visits. We will be asking them that at that point of time also we will be doing the same test, right? And what is the time period? That is 24 to 28 weeks. Between this time, we will be actually repeating this particular test. Then again, if it is becoming negative, that is less than 140 after 2 hours of this particular test, then we'll consider that as negative. Otherwise, you'll consider that as positive and we'll start the treatment according to the GDM management guidelines, right? So that is about the OGTT test. Now, what we'll be doing, how we are doing the GDM management, right? In detail, you will be reading that in the Obs-Gynae and the medicine. But over here, let me tell you, in the GDM management, if some female is actually diagnosed with, if she is diagnosed with the gestational diabetes mellitus, we are having the medical nutritional therapy, guys, right? We are having the medical nutrition therapy, that is MNT, that is a medical nutritional therapy, right? We will be giving the medical nutritional therapy. We'll wait for 2 weeks. After 2 weeks, we'll check for the results, right? So fasting glucose and 2-hour postprandial, we'll be checking for that. If it is negative, then you are good in your treatment. If it is less than, if it comes less than 95 gram per deciliter or 95 gram per liter, 0.95 gram per liter, that is, you are good over there. If it is positive still, more than 0.95, then that means you need to give this female insulin over there, and you need to refer this female to the physician as well, so that they can take care for the diabetes component, right? Okay, so that is about, if it is negative, then continue with the nutritional therapy. Okay, so that is about what? That is about the gestational diabetes mellitus management, right? Okay guys, once we are clear with that, in India, usually 10 to 11% of the pregnant females are having the gestational diabetes mellitus, right? And usually, out of those 10 to 11% of females, 1 to 2% of females might be needing the insulin as well. Otherwise, the rest of the females might be managed with the medical nutrition therapy simply, right? So here in India, I am saying that in India usually, right, around 10 to 11% of the female, right, they are having the gestational diabetes mellitus, right? They are having GDM, right? Out of those, 1 to 2% need the insulin. Otherwise, rest of them might be, might be treated with the medical nutritional therapy in itself, right? Now we shall be talking about a special program over here, that is the Anaemia Mukt Bharat, right? Anaemia Mukt Bharat. In English, it is Anaemia Free India, right? Anaemia Mukt Bharat over here. Anaemia Mukt Bharat program. Okay, Anaemia Mukt Bharat program. Here, this symbol is very, very important. Please remember this symbol because very frequently it can be asked in the MCQ, right? It has been asked in the past as well. This is the symbol for the Anaemia Mukt Bharat, right? Now, Anaemia Mukt Bharat is talking about 6 into 6 into 6 strategy, right? Very simple, guys. 6 into 6 into 6 strategy. I mean, 6 beneficiaries are there, 6 interventions are there, 6 institutional mechanisms are there involved in this Anaemia Mukt Bharat. What are these? In this particular image, you can see over here that what are the 6 beneficiaries. Let me talk about the 6 beneficiaries over here. First beneficiary over here, you can see that children from 6 to 59 years of age, right? 6 months to 59 months, I mean, not years, 6 to 59 months of age. That is the first beneficiary. Second beneficiary, children from 5 to 9 years of age, right? Second one. Third, adolescent girls and boys who are going to the school, right? And the girls who are not able to go to the school as well, they are also the part of this Anaemia Mukt Bharat program. But the boys who are not going to the school, in the adolescent boy, if they are not going to the school, they are not the part of this Anaemia Mukt Bharat program. Yeah, that is the thing. So adolescent girls and boys, right, 10 to 19 years of age, women of reproductive age 20 to 24 years of age, pregnant woman, lactating mother 0 to 6 months child over here, right? Beneficiaries, we have talked about the 6 beneficiaries over here. Okay, now 6 interventions are also there, guys. What are the 6 interventions? Prophylactic IFA supplementation, iron folic acid supplementation, we'll talk about that. We should be doing the deworming, we'll talk about that. Then intensified year-round behavior campaign, right, communication campaign, this body is there. Testing of anemia using digital methods, mandatory provision of iron folic acid foods in the health programs, government health programs, and addressing the non-nutritional causes of the anemia, right? These are the 6 interventions. Institutional mechanism, if you are talking about 6 institutional mechanisms are there. 6 institutional mechanisms can be there. National Anaemia Mukt Bharat unit, intra-ministerial coordination can be there, strengthening the supply chain and the logistics over there, convergence with other ministries, National Center of Excellence and Advanced Center on the Anemia Control and Anaemia Mukt Bharat dashboard, right, and the digital portal, right? So that is about the 6 into 6 into 6 strategy as far as Anaemia Mukt Bharat is concerned. So 6 beneficiaries are there, 6 interventions, 6 institutional mechanisms, right? Now we shall be talking about the iron folic acid supplementation. So we shall be talking about the iron folic acid supplementation and the deworming right after that. So if we talk about iron folic acid supplementation, guys, here this is the table which is very important, right? Here according to the different age group, right, we have talked about the beneficiaries, right? According to the different age group, we shall be talking about the iron. What are the doses? Doses are very important over here, guys. What is the dose for different age groups as far as iron and folic acid are concerned, and separately you should remember the iron dose and the folic acid dose. So it's very easy as well. If you talk about the 5 to 59, I mean 6 to 59 months of age or 6 to 60 months of age, at that period of time, 6 to 60 months of age, we should be giving the iron folic acid supplementation, right, by the syrup, in the form of syrup over there, right? And we are giving that bi-weekly, right? Bi-weekly we are giving that. Okay, so what is the dose, guys? Dose is very important over here. Dose is 20 mg of elemental iron and 100 microgram of folic acid. So 20 milligram of iron and 100 mcg of folic acid. Very important. I am talking about the 6 months to 59 months of age, right? 6 to 59 months of age, that is about 59 or 60 months of age, that is around iron folic acid supplementation. In that group, 20 mg of iron and 100 microgram of folic acid bi-weekly we are giving in the form of syrup, right? Okay, now 5 to 10 years of age, we are giving that tablet. Now from the syrup we are coming to the tablet. Now these tablets, okay, we are having the dose of 45 milligrams of elemental iron and 400 micrograms of folic acid. So now we are increasing because the age is increasing. So we are giving the 45 milligrams of iron and 400 micrograms of folic acid now, right? So here we will be giving that as weekly. Syrup we were giving bi-weekly, but here we are giving this tablet weekly. Okay, fine. This is usually the pink tablet. Okay, and if you talk about the syrup, that is usually colorless. Then we are coming to the next one, that is the 10 to 19 years of age. If you talk about 10 to 19 years of age, what is the dose, guys? 100 milligram of iron and 500 microgram of folic acid, right? Now that will be same for the pregnancy and the lactation and the non-pregnant female as well, right? So here we are seeing that 10 to 19 years of age, these are the adolescent groups. We know these are the adolescents. So adolescents are also beneficiaries of this program. So 100 mg of elemental iron, 100 microgram, 500 microgram of folic acid, and again we are giving that as weekly, right? Again we are giving this weekly. Okay, understood. Then pregnant and lactating women, right? Here they are giving same 100 milligram elemental iron and 500 microgram of folic acid, right? Okay. Now, but one thing is there, we are giving this particularly iron and folic acid tablets, right? One tablet daily for 100 days starting after the first trimester. Always remember, in the first trimester, we are giving only folic acid to the female. Iron is contraindicated because iron is teratogenic. Iron is contraindicated in the first trimester of pregnancy. We are starting the iron in the pregnant female after the first trimester, right? I mean from the second trimester we are starting the iron in the female, not in the first trimester. In the first trimester we shall be giving the folic acid, but not the iron. Iron will start from the second trimester, okay? Please remember that. So, you know, we are giving that first 6 months we are giving, that is 180 days we are giving in the second and third trimester, and that is around 180 days. 180 days we are giving in the pregnant female iron folic acid. Then we will be continuing it after the birth of the baby. We are not stopping that, we are continuing it, one tablet daily. We are continuing that, and we are giving it in the first 6 months of lactation as well. That is again 180 days. So 180 days of second and third trimester, 180 days of lactation. One tablet daily iron folic acid supplementation we are giving like that. Women in the reproductive age group, again 100 mg elemental iron, 500 microgram of folic acid. Those are very important, especially this one. This particular group is very important, guys. This particular group is very important. It has been asked multiple times. Okay, so 100 milligram of iron and 500 microgram of folic acid we are giving. Okay, fine. One more thing you should remember, that 180 days, right? 180 days plus 180 days. Okay, 180 days of lactation and 180 days of second plus third trimester. Okay, so please do remember that as far as iron folic acid supplementation in the pregnant ladies are concerned, that is very important. Okay, so once we have talked about that, one more thing I shall be documenting, that I told you iron is teratogenic in first trimester, so should not be given. Iron is teratogenic in first trimester, right? So iron is contraindicated in first trimester, right? And it should be started in which trimester, right? Should be started from the second trimester, right? So iron is started from second trimester, okay guys, from second trimester. So please do remember that. And after that, I told you 180 days during the pregnancy, 180 days after the pregnancy during the lactation period, right? Okay, and I told you about the dose as well, right? Okay, then we shall be talking about the deworming, guys. We shall be talking about now the deworming, okay, deworming. Now for the deworming also, it's a part of our Anaemia Mukt Bharat program only. So we know about the 6 interventions which we were talking about. Among that, iron folic acid supplementation was included and the deworming is also included. If you talk about the deworming, guys, for the different age groups, we are having the different doses over there, right? So dose for 1 to 2 years if we are talking about, right? Dose for less than 2 years, it is generally 200 mg, and dose for more than 2 years, it is generally 400 mg. So usually one tablet is having the 400 mg dose, and if we want to give it less than 2 years of age to the children, then we will be giving it half tablet. We'll be giving them half tablet. If we want to give it more than 2 years of age, we'll be giving the full tablet of 400 mg albendazole, right? How we are giving it, I will be coming to that. For example, here we are talking about if it is less than 2 years child, then we are giving the 200 mg of albendazole, and if it is more than 2 years of child, then it is 400 mg of what we are giving? We are giving both of them albendazole, right? Okay, albendazole. So very, very important over here, right? Albendazole is what kind of drug over here? This is the anti-helminthic drug, okay? So very, very important. Fine, guys. Next point over here is, we are celebrating the National Deworming Day. National Deworming Day. Here the interesting thing is we are having 2 days for them, because we are giving twice a year. This tablet we are giving twice a year. So that's why we are having the 10th of February and the 10th of August, right? So 10th of February and 10th of August. 10th of February and 10th of August, these are the 2 days where we are celebrating the National Deworming Day. So this is also called as the because of biannual dose. So in a year we are giving the 2 doses, that's why biannual dose we are giving, and that's how we are celebrating the National Deworming Day. Okay, guys. Now, one more point over here. If we talk about the pregnancy, right, and if we talk about the supplementation, right, we'll talk about what supplementation we are giving. So in the pregnancy, we are giving the iron and folic acid supplementation. We are giving the deworming. And after that, we are supplementing the female with the calcium also, because usually there is calcium deficiency, right? But calcium should not be given with the iron, because calcium will be inhibiting the absorption of iron. So that's why calcium and iron should be given separately. I mean, in the morning, if the female is taking calcium, then iron should be taken at the night time, and vice versa, right? So how to treat worms? So this is only the deworming technique which I was talking about over here for the different age group. We shall be remembering this particular table. I told you that deworming drug we are using the albendazole, that is 400 mg. If we want to give it 200 mg, for example, less than 2 years of age, then we'll be giving half of the tablet. So albendazole is present over there, right? This could be present like this, right? Albendazole tablet you can see over here. So 1 to 2 years, less than 2 years, we are giving the half of the tablet, that is a 200 mg of the dose, right? 2 to 3 years, more than 2 years, we are giving the full tablet only, that is 400 mg, right? And 3 to 19 years, obviously again 400 mg of albendazole we are giving, right? It is safe for both children and the adult also, and has been used to treat millions of people, and to treat the helminths over there, mainly the ascaris and all. It is the anti-helminthic drug, as I told you earlier as well, right? Okay, guys. Fine. They should not be chewed or crushed, because they might be having the lower effectivity due to that, right? Once you have talked about that, if you talk about supplementing pregnancy, they should be having, iron folic acid supplementation we are giving them, deworming we are giving them, and calcium tablets also we are giving to them 500 mg, right? Okay, we might also be giving the injections, guys. 2 doses of tetanus injection we might be giving them. If we talk about 2 doses, if we talk about injection, 2 doses of TD vaccine, tetanus and diphtheria. 2 doses of TD vaccine can be given with the gap of 1 month or 4 weeks. Okay, it should also be given to the pregnant female. Now, if they have already taken this vaccine before 3 years, right? I mean just previous year or just 2 years back they had taken this, then only the booster dose is enough, right? Okay guys, now we have talked about that. Now we shall be talking about the intranatal care, right? Now we shall be talking about the intranatal care. Okay, in the intranatal care we are talking about the LaQshya program. Now before that, it should be conducted by the trained personnel. Intranatal care, I mean the delivery of the baby. Delivery of the baby should be conducted by the trained personnel. Obviously, trained obs and gynae doctor should be there who is delivering the baby. And then second thing over here is that the delivery should be safe and delivery should be clean, right? So we are talking about the LaQshya program. LaQshya program is actually making sure that. So LaQshya program we are talking about. This is the symbol of the LaQshya program. Please remember that, right? The LaQshya program, like target kind of symbol is there, right? So a female is holding her baby, right? This is the LaQshya program, right? So please remember that because images are very, very important over here. So LaQshya program, according to LaQshya program, right? They're talking about the cleanliness, right? 6 cleans of pregnancy we are talking about, right? 6 cleans of pregnancy according to the WHO. Okay, and according to the LaQshya program, they are talking about the intranatal care. Antenatal care we have already talked about before the birth. Now during the birth, antenatal care means during the delivery, it should be the safer delivery. The instrument should be used. They should be clean, right? There should be the clean environment over there. The labor room should be clean over there, right? All of these kind of things we should be making sure that these are clean only. Mainly, especially in the government hospitals when the deliveries are happening, we should be making sure that the infections, mainly we need to protect the baby and the mother from the infections basically, because mother is already immunocompromised in this case during the pregnancy, so she might be taking the infections to their home, right? That's why the cleanliness is very, very important. What are the 6 cleans of the WHO according to WHO, right? There should be clean hands of the attendant who is actually doing the delivery and who is who is assisting the delivery. So they should be having the clean hands. Obviously, clean surface should be there, right, where the delivery is happening. We should be giving the clean incision. If you are using the blade over there, clean blade should be there. Clean cord tie, right? The clean towels to dry the baby and then wrap the baby, right? So usually what happens is that after the delivery of the baby, right, we'll put the clamp over there. We'll wait for some time. We'll put the clamp and we'll be cutting the umbilical cord, right? Umbilical cord, after that, they as far as baby is concerned, it will be drying off, and it will be automatically it will be cutting off, right, later on usually. And if you talk about the mother side, it is connecting to the placenta. So you must have studied about the stages of labor: first stage, second stage, third stage of labor. So in the third stage of labor, we are delivering, after the delivery of the baby, we are delivering the placenta, right? So once the placenta, then gradually we will be delivering the placenta as well. Meanwhile, the baby will be giving it to the pediatrician. They will be drying the baby and all, and as soon as possible it will be given back to the mother by assigning all the signs in the baby and all, right, and the Apgar score and all of these things, and then it will be giving back to the mother, right? So that is the thing over here. So clean hands, clean surface, clean blade, clean cord tie, clean towels to dry the baby and then wrap the baby and then giving it back to the mother, and clean clothes to wrap the mother as well. Okay, so these are the 6 cleans of WHO which we need to remember. Okay, now what about the PNC visits, post-natal care visits, right? Now let's talk about the PNC visits, guys. Now antenatal care visits we have talked about. WHO says 8 visits, minimum 8 visits, and Government of India says minimum 4 visits. Here, if you talk about the post-natal care visits, PNC visits, they are saying that what is the WHO recommendation? Let's talk about that first. WHO recommendation. Okay, according to the WHO, right, birth till 3 days, from the birth till 3 days, there should be visit twice daily, right? Twice daily. Then 3 days till cord drops. Cord drops. I'm talking about the baby, right? Till cord drop. 3 days till cord drops. There should be daily visit. Okay. This is according to WHO. right? C, third one, cord drop, from cord drop till 6 months, right? They are saying monthly visit should be there, and from 6 months till 1 year, right? We are talking about quarterly visits, right? That is about that. Now obviously from the birth till 3 days, right, we are talking about twice daily, because the complications which are related to the mother, because if you talk about the mother complication, there could be PPH, which is a very big fear in our mind, right? And if you talk about the baby, there could be complications like respiratory problems, pneumonia, and all of these things can be there. Jaundice problems can be there, right? Because of high rate of high bilirubin over there. So jaundice chances are there, and all of these things we need to monitor the baby, right? So in that sense, twice visits are recommended from the WHO side, right? Now, if we talk about the NHM guidelines, right, National Health Mission guidelines for the PNC visit, they are saying the 4 visits are minimum visits over there. So, according to the NHM, right, now we have talked about the WHO. Now, according to NHM, if we talk about India, National Health Mission, guys, National Health Mission for PNC visits, postnatal care visits, they are saying that 4 visits you need to remember. Now, this you need to remember for your exam, right? They are saying that 4 visits should be there, like 1 visit day 1, then day 3, then day 7, and then day 42. How many visits in total? There should be 4 visits in total. So 4 visits for antenatal care visit, and 4 visits are should be minimum visits for the postnatal care visit. So 4 and 4 you need to remember according to India, right? Now, if in case there is low birth weight babies, that is for the normal babies. That is for the normal cases. If the low birth weight baby came, right? I mean the low birth weight baby is there. Low birth weight baby or low birth weight babies, in case of low birth weight babies, we need to make sure that will it be needing lesser visit or same visit or more visit? It will be needing more visit because it is low birth weight baby. So in that case, they are saying day 1, then day 3, then day 7, 14, 21, 28 and 42. How many? 1, 2, 3, 4, 5, 6, 7. So total 7 visits are there, right? Total 7 visits are mandatory for the low birth weight babies, right? So in this particular session, we have talked about the antenatal care visit, we have talked about the intranatal care, and we have talked about the postnatal care, right? We have talked about the Anaemia Mukt Bharat program, right? In the Anaemia Mukt Bharat program, we came to know about the 6x6x6 strategy, right? Where we have to talk about the 6 beneficiaries, 6 interventions, and 6 institutional mechanisms, among which we have talked about the iron and folic acid supplementation, very, very important, and we had to talk about the deworming, right? So with that, we have finished off this topic, and I will be seeing you in the next one. Thank you.